The most frequent question I get regarding FMT for IBD from my patients is, how do I get FMT? A lot of patients who've got active Crohn's disease and ulcerative colitis are looking for a non-drug treatment for their IBD. Some of them perhaps are worried about the immunosuppressive side effects of corticosteroids or TNF inhibitors, so they are Googled and found that FMT has the potential to treat IBD without immunosuppressive therapy. So fecal microbiota transplantation has got some data for treating ulcerative colitis, but so far we're only using it for research. So we're only having patients come into the studies of FMT if they agree on ethical principles, but so far it's not a commercialized product. So is there a difference in the role of FMT in ulcerative colitis and Crohn's disease? Well, a lot of the data so far we have relates to ulcerative colitis only. Ulcerative colitis is an easier disease to measure because we can perform sigmoidoscopy and have direct access to tissue for biopsies, and we can also measure symptoms in a more controlled way. Crohn's disease is more heterogeneous, so it's a more difficult disease to measure, and so FMT trials have not been well conducted in Crohn's disease at the moment. By good studies, I mean well-controlled studies using placebo as well as the active FMT products. So we look forward to seeing some well-conducted FMT studies for Crohn's disease, and I know they're being studied at the moment. So please give us the key findings with sharing from recent research trends on FMT. FMT research is a very hot area in IBD, and I think the ability to treat the disease without using drugs is a very attractive option. So some of the key findings I'd like to talk about include the LOTUS study, which we directed in Australia and published 2 years ago in Lancet Gastroenterology and Hepatology. In that study, we recruited patients with active ulcerative colitis, and they were treated with either FMT capsules or placebo capsules. And what we found at 8 weeks was that patients treated with FMT capsules had a 53% proportion enter into clinical remission with endoscopic response and remission, compared to only 15% in the placebo group. So that's quite a big statistical difference. Even though we finished the trial earlier and we under-recruited for that study, we were able to see quite a large divergence. But even more interesting was that patients who were able to continue the FMT ongoingly for another 48 weeks at the maintenance rates of 2 capsules daily at 56 weeks, all of the patients who were on FMT were in endoscopic, histological and clinical remission. Compared to patients who withdrew FMT, all of them had flared. So it indicates to us that ongoing FMT to be continually effective in a maintenance of remission, which hasn't really been looked at so far. So I think they are some of the very exciting data that has come from FMT in treatment of ulcerative colitis to date.